podcast includes commentary and conversations about issues relevant to clinical psychology. It is intended to educate, entertain, and enlighten, and is not a substitute for actual mental health treatment. Individuals who share personally here choose willingly to tell their stories to benefit you, the listener. All other references to clinical situations are altered or limited to protect confidentiality. For more specific questions or help with a personal situation, please consult a local mental health professional. Therapy, mental health, real life. This is Psych Rally with Los Angeles-based clinical psychologist Dr. Martin Hsia.
Okay, welcome back. Thank you for tuning in. This is episode 22 of Psych Rally, and I have the pleasure today of talking with Dr. Steph Anderson, who is a fellow psychologist, and she has her PhD in critical social personality psychology, and currently lectures with the Gender Studies program at the John Jay College of Criminal Justice in New York City. And she's also a lecturer, researcher, and documentary filmmaker. And today we're going to be talking about her doctoral dissertation, which is titled Disentangling Gender Expression and Race in Anti-Gay Discrimination, an Intersectional Approach. Steph, thanks for joining me today.
Thank you for having me.
Pleasure. Hey, so you and I both have gone through doctoral studies in psychology, and I got to tell you, my degree was in clinical psychology. We read tons of articles, academic journals. We did coursework in statistics and research methods. I did my own dissertation, if you could call it that. But my heart was always in clinical work. I wanted to be a therapist. I was not so much into the research, but picking up your paper was, it read to me like a best-selling novel. It was just so fascinating, and it was like I couldn't put it down. It was so interesting to me. So, and I think it's very timely and important work, so kudos to you.
Well, thank you.
Yeah. Say, broadly what, sort of the inspiration or what led you to pick this topic for your studies was, and what you sort of hoped to learn and illuminate from it.
Sure. Well, so as the title indicates, I was interested in looking at the role of gender expression and race in what LGBTQ people experience. So folks who identify as gay, lesbian, bisexual, and queer. And part of my motivation for wanting to look at gender expression specifically is because homosexuality is often talked about as an invisible stigma. The idea being behind that, unless you verbally disclose your sexual orientation, no one knows you're gay, to put it colloquially.
Right. Although people might presume to think they know if someone's gay or not.
Exactly.
Yeah.
And so that's exactly the piece that I was interested in picking up on, is that simultaneously, although within psychology, we've often talked about this invisible stigma of homosexuality in the lives of LGBTQ people, how people present their gender really matters for how they're perceived. So there is the gender inversion stereotype, for example, that gay men are feminine and lesbian women are masculine. So given that sort of idea, this sort of under-attention or lack of attention to gender expression within LGBTQ experience, I was really interested in understanding how gender expression could factor into negative encounters.
Yeah.
Right. So if folks are, for example, more visibly perceived as being a minority orientation, it's likely that the types of encounters they have will be qualitatively different than those people, for example, who are perceived as, to quote, straight.
Right. You mentioned the gender inversion stereotype, and maybe you can say a little bit more about that in case people listening aren't familiar with the term. But what comes to mind for me is I remember I must have been 7 years old. I was watching TV with my family, and they showed the film Kiss of the Spider Woman. Raul Julia, William Hurt, I think, and it was my first exposure to a same-sex relationship. And how it was explained to me was that these were two men who were together, just like typically was what I knew to be a man and a woman, but that not only are they in a relationship together, but they were also like women. And it wasn't said in a pejorative or insulting way. It was kind of said out of innocence as I look back on it, but it was clearly inadequate. So does that kind of capture what you're talking about with that stereotype?
Yeah, it really does. And the idea behind it is that if you violate sort of one expectation of what you're supposed to be as a man or woman, the expectation in our society being that you'll be straight and therefore attracted to the other gender, that you also will violate some of these other gender norms that go with it. So if you're a woman who's attracted to other women, the gender inversion stereotype implies that, well, there must be something about you that's masculine, because otherwise, how could we account for this fact that you have desire for women?
Right. Those are two totally different things, right? What gender you're attracted to, or what genders you're attracted to, is a completely different phenomenon or construct from how you express your gender.
Right.
Yeah?
Right. And part of the thing that's tricky about this, which is why I use the sort of tongue-in-cheek title of the disentangling in my dissertation title, is that they're often intertwined. So even though we can talk about gender expression as separate from sexual orientation, it is true that a lot of people who identify as gay, lesbian, or queer disproportionately present in ways that transgress gender norms more often than people who do not have that sort of same gender desire.
That's right.
So they're not mutually exclusive in that sort of idea. At the same time, though, they are separate psychological concepts to explore.
So disentangling. They're definitely tangled up together.
But not severing.
Sure, fair enough. Well, and even the title of your dissertation as talking about anti-gay discrimination. I mean, it is even... I think there's a point in your paper where you even talk about, is that even an adequate term? And, even already we're sort of using the term, the LGBTQ community versus the sexual minority community, which I tend to default at times because I feel like I don't want to leave somebody out. And some people talk about how, well, does LGBTQ, does that even capture everyone? People talk about how people who are asexual are sexual minorities, but do they need their own acronym?
Yeah, and I think one of the biggest issues is that even in the acronym itself, LGBTQ, you have two things happening simultaneously.
Yeah.
You're including both people who are sexual minorities, as you described, people who have same gender desire, either exclusively or non-exclusively, and folks who have variant gender identities. So the T in the acronym refers to one's gender identity, which may be separate from how they identify their sexual orientation. So you can have women, for example, a trans woman who also is attracted to women. So she would be a transgender, perhaps lesbian woman.
Right.
And so part of what gets tricky in trying to use a catch-all phrase is that in using that acronym, we sort of conflate both gender identity and sexual orientation. And so within my own work, I try and pull that T out and use the phrase cisgender and transgender LGBTQ people to sort of distinguish between, at this point I'm talking about gender identity, and at this point I'm talking about sexual orientation.
Sure, because we're getting way past just the gender inversion stereotype. We're talking about gender expression, discrimination. Eventually, you're bringing in the component of ethnic minority status. Yeah. But say a little bit more about the gender expression piece, because it's probably something that everyone has thought about whether they called it that or not.
Right. So all of us go through this process in the morning when we get ready of who do we want to communicate ourselves to be in the world. All of us are engaging with ideas about masculinity and femininity, and gender expression just refers to how we embody that. So what clothes do we choose to wear? What kinds of mannerisms do we have when we're gesticulating? All of those are sort of encaptured of the way in which we do gender, essentially.
So, right, and we can express our gender through, as you said, our clothes, our hair, our appearance, how we talk, how we articulate things, how we communicate with people, which makes me wonder, too, if, because as you said, we talk about there's, developing a masculine identity for a cisgender male like myself, or developing a feminine identity for a cisgender female. But it almost seems that, I don't know if at a broader level, that those categories are they moving towards a place of being outdated, or do they just kind of need to be, to make room for other variants of those categories? Maybe that's a better way of putting it.
I would love for them to become outdated. Mm-hmm. Unfortunately, I don't think that we're necessarily moving towards that direction. Mm-hmm. I think one of the things that's interesting about gender expression is that for many people, we often do it unconsciously. We don't even think about that this is a conscious decision that I'm making about in what ways am I expressing masculinity and what ways am I expressing femininity. It's most often for those of us who transgress gender norms that those decisions become much more conscientious, because you're sort of going against the grain of what is expected of you societally.
When you say more conscientious, do you mean that there can be a pull to emphasize those aspects that transgress the norm more, or do you just mean you become more aware of it, that that's what's coming out of you in a sense?
Yeah, I mean, I think you're more aware of it, in part because society tells you about it. There's been much research that's documented how bullying within schools, elementary
Yep.
schools, middle schools, high schools, is very centered around gender. And, the idea that boys should be men or they have to become men. And what does that process look like? That's directly related to the ideas of, well, you have to express yourself like a man. You have to be strong. And so I say that's more conscientious because you're made aware when you step out of bounds what boundaries you're stepping over, because people will put you back in that place.
Right. Yeah, and even I think back to college and being a psychology major, and the courses you go to, and I would look around, and I could count the other guys in the class on pretty much my my 10 fingers, and I felt like that was a place where am I doing? I mean, this is where I thought I was supposed to be, but at the same time, I would ask myself, am I doing something wrong? Am I supposed to? And not only am I the only male here, I'm the only, male, Chinese male, certainly. So there's so many different places where I think for any of us on our journeys that it is brought to our attention, isn't it?
Yeah, and I think that you can also sort of differentiate. We have so many different gendered meanings that exist within society, right? We have gendered occupations, as you sort of point out,
right,
that associate nursing with women, and we sort of associate doctors with being male. So you could think about occupations as the role. Within my own work, I look at gender expression as sort of the minute everyday things that we do, and not necessarily as much as what roles we occupy within society, although those often are interrelated concepts.
For sure. Now, there's also, and you'll be going back a little bit when you talk about how we're talking about gender and gender expression versus gender identity, perhaps, versus sexual orientation. And, so generally people know at least that, marriage equality and sexual orientation, they're known issues. But gender is, as you said, if we disentangle it a little bit and talk about it separately, it's a little bit of a newer thing to talk about, it seems like, which is why research like yours is so on the forefront of it, I think. You use the term gender queer, which to my knowledge is somewhat of a newer term, at least in the last few years to me. And would it be fair to say that that kind of is a term that captures someone who is between the poles of transgendered and cisgendered? Or does that not quite capture it?
I think yes and no. So I also just want to be clear on, because there's so much gendered language that I'm using, and so I just want to make sure that for folks who are listening for whom this terminology might be new, that I'm clear on what I'm talking about. So gender identity refers to our understanding of self as a gendered being. So a person, for example, who was assigned male at birth and identifies as a man would be categorized as a cis male or a cis man. And a person who was assigned female at birth and identifies as a man, or maybe a genderqueer person, they would be considered transgender. So the key in understanding gender identity usually pivots around, well, what does the medical establishment terminology use when that person is born? And then when they grow up, or when they come to realize themselves as a gender being, how do they think of themselves? So within the transgender umbrella, right? So these are folks for whom their birth assigned label doesn't work for them.
Right.
They may identify with one end of the gender binary. So a person who is assigned male at birth but identifies as female would be considered a binary trans person. And so that essentially means that for them, the gender binary, it gives them meaning.
It works for them, yeah.
Yeah, it works for them.
They've just crossed over the binary.
Yeah.
Yeah.
And for a genderqueer person, essentially for them, it's saying, you know what, this binary doesn't work for me so much. I don't know if it's necessarily as sort of in between cis and trans as much as it's sort of encapsulated by the idea of just transgressing gender expectations of identity, period.
Sure. Everyone will have a one of two starting points.
Male, female, intersex is what the medical community uses.
Gotcha, yeah. But where someone journeys to or journeys through, that there's multiple ways that can vary. Genderqueer, is making space for someone who says, I don't identify at this point in my life as one or the other.
Exactly.
I might have traits as that are more, I guess you could say, stereotypically male, and there may be other things that I identify with that are more stereotypically female, and that's regardless of what's under my clothes.
Yeah.
Yeah.
And I think the thing, as psychologists, we actually know very little about genderqueer experiences. We don't know, for example, a person might identify as genderqueer, but presents in a very conventionally feminine way, even though they were assigned female at birth. So what I try to do in my research is to distinguish between your identity is not necessarily your destiny in terms of how you physically present. That your gender expression doesn't necessarily communicate, that your gender identity doesn't necessarily communicate what people might perceive you as visually or in terms of your appearance.
This can have so much a ripple effect even across, I'm thinking of psychometric testing. I don't know if if you're smiling as I say that. People can't see that on an audio podcast, but I mean, there are very widely used tests that we have in clinical psychology that have scales that measure quote unquote masculinity and femininity, and someone will have a score that's determined based on psychometric calculations as to how masculine or feminine someone is.
You're referring to like the BEM sexual inventory?
I'm actually thinking of the MMPI. I don't use it in my practice, but is a tool widely used in forensic and in clinical settings, and that's one of the main scales. So, it seems to me that something like that, maybe there's information that gives, but it's also it can seem antiquated when many more wrinkles get introduced, and we have to make space for different people's experiences.
I mean, I think one of the things that's so tricky about it is that how we express gender is inherently fluid, right? And so, say for example, when I'm hanging out with my friends, I might dress in a more sort of like casual way that might come off as more masculine. But if I'm in a work environment where the stakes are a little bit higher, I might sort of accentuate femininity in a way that I may not. So there's part of the trickiness is that it's not necessarily a stable trait or state,
right?
Which is why I try and really differentiate it from an identity. Yet at the same time, right, we know that it matters.
Sure.
So I think that's why it's included in things like the MMPI, because it does matter in terms of our material existences. Yet at the same time, it's also empirically very tricky to assess in a way that is authentic to the measure or the concept that it is.
Indeed. And I imagine that was a challenge as a researcher. Is like you're talking about terms and constructs that capture many different people's experiences to some degree. But at the same time, how much can you generalize that to so many individuals' unique experiences? It's a challenge of how do you take something out of academia and make it relevant to a real individual person out on the street?
Right. And then also the challenge of how do you translate experiences that are so incredibly personal and felt on a very cellular level for people who sort of live outside of these binaries and communicate that to a world who really sees through a dichotomous lens.
Indeed. One other thing I remember, I think you mentioned somewhere in the paper, was you talked about how in order to, this goes back to the disentangling piece, in order to have a sexual orientation, in a sense, the idea is that you would need to have a gender.
Right.
Right? Because you need to have a point from which am I attracted to the same gender or the opposite gender? But what if my gender is fluid?
Right. Yeah. I mean, I think that's sort of a concept that we often don't think about because it just seems so natural. So much about gender and sexual orientation seems natural that it just sort of emanates from us. Right. But the only way you know if a man is gay is first if he's a man.
Right.
It doesn't make sense for him. How can he have male desire, but not also be a man?
Or you could just say that person has a male desire, but I don't know what he is, male or female. He might be somewhere in between.
Right. But then our sort of classification of sexual orientation becomes moot.
Right. Yeah.
What I think was interesting to your point, though, was that I had 41 people in my research who identified as genderqueer. And almost all of them, I think, except for one, identified their sexual orientation as queer. And queer as a sexual orientation does sort of the same work of non-categorization.
Gotcha. Yeah, it's a little bit of the catch-all. I'm not sure. I'm not straight. I'm not gay. I can
or maybe
just say I'm
I don't
queer.
really care if you know the difference.
Yeah, maybe it doesn't matter. Yeah, I'm attracted to people.
Yeah. Mm-hmm.
So yeah, that's a perfect foray. So talk a little bit more about what you found and the background of the study, and sort of what did you find from it that was confirmatory of what you thought you'd find, and what maybe surprised you or what was different.
That's a good question. So to give a little bit of background on what I was seeking to understand, as I mentioned, I really wanted to sort of disentangle this role of gender expression within LGBTQ experience, in particular the encounters that folks have that are negative. And I was interested in looking at gender expression in terms of why they thought it happened. I was really focused on the subjective interpretation that LGBTQ individuals have when a negative event occurs. And I wanted to add an additional layer to that. I wanted to say, okay, so we know that our experiences are intersectional, that who we are, what we embody in terms of our gender, our race, our class, all of those make us who we are. Right. And that when you ask people to to pull apart or to categorize themselves as terms of one or the other, we can't do it. Right? And so I wanted to account for that complexity of experience in my work. So what I wanted to understand was how LGBTQ people understand their negative experiences, in particular relation to their gender expression as well as their race. And so what I predicted and what I found was that depending upon how people present, depending upon their gender expression, they had qualitatively distinct negative encounters. So for people, for example, for whom they're generally perceived as conforming to the norms that are subscribed to them at birth. So a cisgender woman who presents in a feminine way, or a cisgender man who presents in a masculine way, they often had negative experiences that that characterized their identities as non-existent. So they had experiences of being invalidated. After coming out to a coworker, for example, one woman responded to a gay man and said, "Well, you're so handsome. You couldn't possibly be gay."
Right. Those two don't fit together.
Yeah. Right? And that, again, speaks to that's because of the gender inversion stereotype.
Yeah.
Right? If you don't violate one, right, you are a masculine presenting man, so how could you also be gay? Right.
Or I think I can think of a number of people that I know personally where they sort of say, well, I'm a male and I'm heterosexual, but I'm kind of soft-spoken, and I'm smaller framed, and I dress pretty well, and I worry going into the work setting, will people think that I'm gay? And I'm okay if I was gay, but I'm just not, and I wouldn't want people to come up with some assumption that might, who knows, affect me in some unknown adverse way.
Exactly.
Yeah.
Exactly.
Okay.
So there were these types of invalidation, and there were also a number of stories that were instances where people had negative experiences they probably wouldn't have had if they were, to quote, a visibly queer person. So I'm thinking about one woman, for example, who was describing a coworker who was venting to her about having to share a bathroom with a lesbian woman and how she thought that was disgusting. Right. And as she's telling the story, she said, this is the person who was writing to me, said, well, I am that lesbian woman.
Right. I better not let the cat out of the bag.
Right. But the coworker had no idea.
Yeah.
Right. And so there was this sort of, I call it a double-edged sword in some ways, because on the one hand, being perceived as conforming to what is expected of you can lead you to have passing privilege. Another number of folks said, for example, well, some of the things that happen to me might not happen, or some of the things that don't happen to me probably happen to other people, but people usually assume, or sometimes assume, that I'm straight. Right. So privilege on the one hand, right? But the sword always cuts the other way. And that can lead to this types of invalidations, denial, or unintentional exposure to hostile prejudice.
So there's multiple matrices which can make up one person's experience, just on the factors that we're talking about. You could be, the example I used of a straight person who is concerned, maybe based on past experiences of how their gender expression might lead them to be seen as gay or some sexual minority. And by the same token, you're talking about some examples of people who are, say, cisgendered lesbian female, and heard some, a negative comment and said, "Oh, geez, well, now I'm not so comfortable owning that identity publicly."
Right.
Yeah.
Right. Yeah. And I think that in the example that you give of why it would be negative if someone were even to perceive that person as gay, right? That speaks to sort of like the idea of if being perceived as gay is a failure of what it means to be a man.
Right. And that somehow there's a standard to meet. Being masculine, being a man means a certain thing, and anything that doesn't meet that is not in that ballpark.
Right. Right. And that being straight is one of those top criteria.
Yes.
So those were sort of the experiences of people who I categorized as perceived gender conforming. And then I also had another group of people who are often perceived as gender non-conforming. So a woman, for example, who presents in a very masculine way, or a man who is very effeminate in his mannerisms. They often described types of discrimination where it was happening in public and with strangers, and often unprovoked. So people saying gay epithets to them on the street while they were walking by, or instances of violence, of being beat up. Sort of these classic ways that we talk about discrimination as this hostile act were the types of encounters that they reported, much more so than those who were gender conforming.
In terms of their gender expression.
Exactly.
Regardless of their sexual orientation.
Exactly.
Yeah.
So, right. So the only criteria for folks to participate in my research was that they not identify as straight.
Gotcha.
So everyone in my sample identified as gay, lesbian, bisexual, queer, or another self-identifying term.
I see. Yeah.
And I was looking to see, well, what are the types of experiences they are having, right? And that's sort of how I laid them out. Some of them were very overt. Some of them were more covert. And those fell into sort of two different camps based upon how they thought they were being perceived by other people.
Right.
So for someone who said, for example, she was called a fucking dyke by someone on the street. And when I asked her, well, why do you think you were treated that way? The person described, well, it had everything to do with what she thought I was based upon the clothes I was wearing and the haircut that I had. So LGBTQ people are using how they think other people perceive them in regard to their gender expression as a way to make sense of what is happening in these negative experiences.
And yet with the term attributional ambiguity, it's not always totally clear.
Right.
I mean, if you're discriminated against or have an experience like that, you're going to make meaning of it or search for a way to make meaning of it in some way. It might be related to my gender expression, but is it related to my sexual orientation? Or you introduce the other component of for people who are people of color. How do I attribute that negative experience or what someone said to me? Is it because of the color of my skin? Is it because of the person I'm holding hands with? Or is it because of the clothes that I'm wearing?
Right.
Yeah, it's ambiguous. And that's a lot of work to have to do.
Exactly. So attributional ambiguity refers to this idea of, well, to what do we attribute the experiences we have in our lives? Yeah. And people in my study talked about it not only in terms of if discrimination happened, but also to which piece of themselves that person was responding. So the difficulty with subtle forms of discrimination is that, well, say, for example, I get really bad service at a restaurant. Is it because of actually some prejudice of somebody else or not? Yeah. And then add another layer to that. Is it because I'm gay? Is it because people might perceive me as also trans? Is it because I'm a person of color? So folks did describe experiencing a lot of ambiguity around it.
Indeed.
And one of the things, the outcomes of this that I would explore looking forward is what are the consequences of having this large cognitive load? Because in the stories that people were describing to me, you could tell it was something that still ate at them.
Sure.
That said, well, I don't know. It could be this. It could be that. I want to think it's this, but I don't know. And I think part of the difficulty with psychology, in particular looking at discrimination, is that we've sort of had a one lens mind in thinking about it. Well, if you're a sexual minority and you experience discrimination, well, clearly it must be because of your sexual orientation. But my research sort of shows that gender expression really matters, and that what is expected of us based upon our birth-assigned gender is incredibly racialized. So when we talk about gender norms, we're not talking about race-neutral norms. We're talking about norms that are largely predicated on the experiences of white individuals.
Mm-hmm.
So the question of whether someone is violating gender expectations is always going to be racialized through that lens. And you can see that through, if you were just to think about, well, what are some of the racialized gender stereotypes we have about Black women or about men, or when you were making an example of being an Asian cisgender man, right? There's sort of a whole schema that gets drawn up for folks.
Absolutely. I mean, and it's perpetuated by film and media. And, I think I was doing some reading about how, there's that stereotype of, for Asian men, right, that were sort of stereotyped as less masculine and in turn perhaps more likely to be gay.
Right.
Or for a Black female who they're the stereotype of, being strong and outspoken, and then that there's a stereotype of being less feminine and in turn perhaps more likely to be lesbian.
I think you were just citing one of the papers I used in my dissertation.
I read it somewhere.
Yeah, absolutely. And so I think that as psychologists, we have a responsibility to sort of hold all of that in its complexity when we're thinking about how we're going to deal with issues of discrimination and the consequent psychological mental health issues that might result from that.
Right.
That all of those pieces need to be held together. So I also want to emphasize that in talking about sort of these intersectional oppressions, which I think is kind of where we're going, that it's also important to talk about where the privileges sort of come out too.
Yes.
And so I talked a little bit about how people who are perceived as gender conforming might talk about having, to quote, passing privilege, that they might be perceived as straight, and that in and of itself can protect them against something negative that might be related to their sexual orientation, right? But there is the cut the other way. There is the double-edged sword. White folks in my study talked about white privilege in that being sort of the absence of a negative experience. When I asked them, well, how much do you think your race mattered in this encounter? Often white folks were unable to describe whiteness as actually being present. Why would you ask me about race? I'm white.
Right.
The important difference, though, is that there's no double-edged sword that cuts back with being white. It was always the absence of something worse, at least how they understood it themselves, at least as the white participants understood it themselves. So they thought about it as not necessarily a privilege, but the absence of a negative.
And I can remember one person, I think, that you quoted somewhere in the paper saying that, I can't remember the experience that this person was talking about, but they said, if I wasn't white, that would have been way worse.
Yeah.
It would have been worse if I was a person of color. Somehow that would have added an extra layer of, well, I guess you could say, would that have made the experience of discrimination worse, or would it also have just added an extra layer through which to sort through in terms of attributing and interpreting the situation?
I think that's a question that sort of remains unanswered. And I think that what I really try and do in my research is not necessarily to get into ideas of stacking oppressions or characterizing or comparing oppressions, but to see how they're interconnected.
For sure.
And so to point out that at the same time we're talking about being perceived as a person of color and what consequences that might have, in particular if the perpetrator is white or not, or even another person of color, which they also described instances, that you simultaneously have to hold on to. If there's oppression, there's always going to be privilege somewhere. And that as psychologists, we have a responsibility to interrogate both. And we really haven't delved too deeply into the privilege side.
Yeah, I think this is why a study like yours is so fascinating and so important, because there hasn't been a whole lot of work done on this yet. The other thing that was that stood out to me that I hadn't thought about on this topic was how even within the sexual minority community there can be persecution between, say, people who are LGBTQ perpetrated upon one another, between someone who is of ethnic privilege upon someone who is of color.
Yeah.
And some people talked about those experiences. And, I think without realizing it, you can sort of think, well, sexual minorities deal with discrimination and oppression, but you don't think of it happening from within the same community. But I suppose there's definitely no reason why it couldn't happen, and clearly it's reported in your paper.
Yeah, I mean, I guess part of the issue is that LGBTQ experience is not monolithic. That, predominantly gay and lesbian rights movements have worked towards the betterment of white middle-class gay and lesbian men, often at the expense of queer people of color, in particular transgender people of color, as we've seen most recently with the increased number of murders of trans women of color. And so to think that LGBTQ people, because they might experience some sort of stigma because of their sexual orientation, would then also be free of having other racist or racialized biases or classist or ableist,
That doesn't make sense.
Yeah, we all sit in it.
Well, and as you say that too, is as you talk about someone who is transgendered female of color, and why are those individuals particularly vulnerable? Well, they're disadvantaged upon multiple layers of identity, unfortunately.
Yeah, and I also think that for trans women specifically, it's much harder to be perceived as cisgendered, even though a lot of them wish they were to pass. And so we know that trans women are disproportionately underemployed, in part because employers don't want to hire someone who visibly looks at trans.
Right.
And then if you add on top of that the intersection of race, a lot of trans women of color have to, if they don't have employment, they work the streets. And that makes them vulnerable to other forms of violence as well.
Vulnerable to violence, vulnerable socioeconomically, basically in every way, shape, or form. So hopefully through this research, we can talk about ways that this can be applied societally and individually in ways that help people who are in most need.
Yeah.
You started to draw the bridge into kind of mental health, and obviously that's kind of more broadly speaking the world that I live in. And you mentioned the term the cognitive load, as well as, and I think we kind of were talking about attributional ambiguity, and for someone who is genderqueer and a person of color, right, all the layers of needing to sift through as to why I'm being treated a certain way, not getting good service. There's just a lot more that individual needs to think about than a cisgendered heterosexual white male.
Yeah, I think that's true. I mean, I think that I didn't necessarily assess sort of conventional measures of cognitive load and distraction and all those clinical ways that is assessed. It was more sort of a conceptual characterization of how do I make sense of all of these multitude of attributions that people are working through. I would guess that for people who are experiencing greater levels of attributional ambiguity, that they would likely have that would have some sort of negative psychological health outcome. Because if you think about the perseveration of when something bad happens, the continuing to revisit and then revisit and the rumination that happens from that. I mean, I'm sure that you've worked with that in clinical settings as well, of that, the consequences of perpetually ruminating about something. But I also think it's important that we not sort of group folks based upon their social positionality of where they may or may not have a lot of load. One of the things I didn't look at, for example, was the idea of stigma consciousness. So some people are more likely to ruminate and to perseverate over things that happen to them, or they might be looking or more readily think that maltreatment is a response to discrimination in one form. Right. It could be possible, for example, that people who are experiencing multiple forms of discrimination might not even experience that as much.
Because they wouldn't interpret it that way, perhaps.
Or because they become calloused. So I think there's sort of some open questions that are sort of left there. And I think that some research that we've seen of looking at social identity from an intersectional lens, that it's not just about added layers of oppression, but there's also elements of resilience that come from sort of sitting at multiple intersections of oppressed identities.
Indeed. Yeah. And I think maybe what I'm highlighting too is, working with a lot of people, say with social anxiety disorder, who say, someone, for example, will say, I went to the gym and someone gave me a funny look. And part of me had this thought that this person wanted to fight me. And I don't know if that's true, but they start to ruminate on that and get caught up in a fantasy version of potential reality, which causes anxiety. And in turn, someone might want to avoid the gym or whatever place that something like this happens. And if for someone who goes through an experience like that, who happens to have other privileges, again, who doesn't have to deal with already the things that you're talking about, that's already hard enough. The anxiety disorder in and of itself is can already be so debilitating and altering to someone's life functioning. But if someone has to deal with social anxiety because of their fundamental appearance, color of their skin, how they express their gender, every day in every situation, that, man, it must be even harder. The amount of cognitive load just has to be firing on more cylinders all the time.
Yeah, and I think that people have to negotiate when they're willing to sort of shoulder the fight and live authentically, and when the battle feels like it's too much.
Right.
You know, some people talk about that within the queer community, about not trying to pass, but just conforming a little bit more so the reactions from strangers or the people that they encounter is a little bit easier. And the trade-off with not having perhaps as negative of experiences, but yet at the same time not necessarily embodying your authentic self. I think, to your point, is sort of the other piece that comes into that, right? It's not just how you're negotiating in the social world, but then also how you're negotiating your own understanding of self in that world.
So often in psychoanalytic literature and developmental psychology, we talk about how people can grow up in family systems where the messages given implicitly or explicitly were that one's own emotions, thoughts, feelings were sort of secondary to someone else's, primary caregivers or otherwise. And to me, that's what I think of when you're talking about how, even as an adult, someone grows up and because of their appearance or their gender or their sexual orientation, they're always doing that work and having to monitor and, adjust how I carry myself, what I wear, based on, as you said, whether you're teaching or whether you're just out on the street with some friends. And there's, when there's fear and anxiety for potentially being treated poorly, you just have to be that much more conscious about that. And it's just more work.
Right. And people project their insecurities onto you, right? I think about folks who say, I'm fine if you're gay, just don't act like it.
Right.
Right. That's sort of saying that you should have the onus.
Right.
Of your physical self making me uncomfortable.
Right. It's I'm okay that you're Chinese and American, just don't be Chinese around me.
Right.
As if it's that simple.
Right.
Whatever that means. And I'd have to think too, here's another piece on the mental health component, is when you're talking about discrimination that becomes actually violent. If there's actual, aggression or trauma, right? And with PTSD, there's a cognitive behavior therapy approach called cognitive processing therapy, developed towards people with post-traumatic stress. And what I really like about it is that it highlights particular themes that someone has to make sense of and sift through after they've been through trauma: safety, trust, intimacy, power and control, right? Self-esteem or esteem for others. And those things are all affected by, just say, a violent event. But again, someone might have to, you add extra layers to this for a person of color and or sexual minority because, right, why did this happen? And the trauma itself, again, is tough enough to deal with. But when you have so many other layers to try to make a coherent narrative out of in the healing process, it can be even more debilitating, I imagine.
Yeah, and I think that's why sort of understanding what sits at the intersections of these experiences is so important for clinical and counseling work, right? Just so the diversity of clientele and the different experiences that they bring into the room can be acknowledged in all of their complexity.
All of this makes it pretty understandable why there's some statistics I got off the NAMI website talking about how sexual minority individuals are almost 3 times more likely than others to experience major depression or generalized anxiety disorder. LGBTQ youth are 4 times more likely to attempt suicide. I mean, these are astounding numbers, but I mean, you're illuminating the intricacies and the ins and outs of why it's so much harder to be a sexual minority, let alone a sexual minority of color in some situations. Yeah.
Yeah. And I also just want to draw us back that I think so much of it, what I try to highlight in my own work, is where it all sort of situates back to gender again, is that so much of the bullying that happens to kids when they're growing up who are a sexual minority, in particular gay boys, relates to them being called a sissy or a faggot or any of these other sort of very gendered terms, right? It's because it's really related to their failure of masculinity being associated with their sexual orientation. And even the same way as thinking about folks in my study who had the passing privilege at times, the types of experiences, the negative encounters they had, still related to gender in some sense. They were still violating some expectation of gender. If you're a feminine presenting woman, but you're also a lesbian, well, you're not really fulfilling what you should be as a woman still.
Right.
The same way that if you're a masculine presenting woman, you're still breaking that idea. So I think what I want to highlight is the inherently gendered nature of homophobia.
Right.
And that until you sort of address the societal issues that we have with gender and how our ideas about gender are so intricately intertwined with race, discrimination based upon sexual orientation, it's not going to go anywhere.
It's going to be there.
Yeah.
I think about how deeply ingrained it is too. I mean, you can go all the way back to finding out a friend or relative is expecting a child, right? Is it a boy or a girl? It's one of the first questions.
Right.
And then you have a baby shower. It's a boy. It's a girl. It's one or the other. And then based on that, people start buying clothes.
Right.
People start giving little dolls and pink dresses versus, blue blankets and cars,
Yeah, and I guess my question would be for those folks who are so interested and invested in knowing, right? Why?
Why?
What is at stake for you that you need to know?
Well, you got to know what present you're going to buy because that dictates everything from there, right? I'm joking, of course, but yeah, it's no, I think what I'm, and I shouldn't make light of it, but is I think of for any particular individual, say in your study, that person interacts with countless individuals throughout their life, and each of those individuals has their own lenses and experiences and people in their life that shapes and informs their experience of gender, and they're going to experience that one individual a certain way, and some are going to be more accepting and loose with how they receive and treat that person, and some are going to be much more rigid, and maybe that's where the problem is.
Yeah, I mean, think about what happens when we encounter people for whom they're very gender androgynous. The most common response that we have when people are willing to admit it is we often stare. Because if we can't determine the gender of somebody else, our sort of script that we have for the subsequent interactions that we're going to have with that person is not laid out for us.
Sure. Well, I can't just interact with them as a person. I've got to know a gender first.
Exactly.
Yeah.
Exactly.
I see. On a more positive note, we're talking about obviously some of the challenges and unfortunately some very negative experiences that people in the sexual minority and sexual minority of color community have had. From what you found in the study or anything that you've learned about or researched, are there any benefits of being a sexual minority and or things that you're seeing that are protective qualities for someone who, say, is genderqueer or non-binary?
Yeah, I mean, I think there's a lot. I mean, one of the things that stood out to me in reading through these narratives of folks was, to some extent, the humor and the candidness of the stories that they were telling. To some extent, I thought at times writing the narratives out for me as the researcher was a little bit cathartic. And I could tell that they were speaking to me as the audience of this internet survey, as someone who was part of their community, as if the questions I was asking sort of gave them that I was in the know. Yeah. And I think that for people who live at the margins, whatever those margins might be, there's still solidarity and community that's always found within and among the people who are at those margins. And so I think that in and of itself sort of fosters the resilience that a lot of queer people do experience. That, yes, we do have some pretty staggering statistics about negative mental health outcomes and the increased risk of suicidality. But at the same time, I think the community and the sense of living authentically can also be really freeing. And I think specifically related to issues of gender, a question I would want to explore in the future, I can just only answer this in terms of my own experience within the LGBTQ community, is that when you're already violating one expectation of gender, say in relation to your sexual orientation, it can be a little bit freeing for you to violate others. That maybe that's how we account for the fact that the gender inversion stereotype is a stereotype that does have a little bit of truth attached to it. If I'm, a masculine, if I'm a woman and I have desire for other women, I no longer have to now be desirable to men, which means that I don't have to present myself necessarily in as stereotypical ways that I thought I had to. And instead, I can be maybe more me. And maybe that more me isn't sort of as rigidly feminine.
Once I've been challenged to sort of break one mold, I've sort of had that experience, I can feel more empowered in a sense to question or challenge others.
Yeah. Yeah, I think that's definitely one of the benefits, for sure.
Well, and I like the fact too, as you talk about people sharing their stories, you made it safe. And I think for people that, again, are marginalized and have experiences of being discriminated against and mistreated, someone like that in particular needs a safe place, people with like-minded experiences and people who are accepting and can understand the experience. So that carries over probably to the clinical setting as well, I hope.
Yeah, that's a good connection.
At a societal and policy level, we're in very interesting times right now, obviously. What do you hope for in terms of what your research, say this study and others in the future, how do you hope tangibly that might affect resources, understanding, policy perhaps? Because there's a lot of change that's happened, but there's clearly a lot more that needs to happen.
Well, I think I'll answer that two different ways.
Okay.
I think there's we're at sort of a great perilous moment in terms of thinking about advancing the rights of LGBTQ individuals in particular. Yeah. We've already seen sort of the assault that happens on transgender people in regard to bathrooms. I think what I would hope that my research would do is highlight the need to triage the lives of those who are most in pain. That as an LGBTQ community, we have a responsibility to take care of those who are most susceptible and vulnerable to societal harms. Yeah. And I think up until now, we've been really focusing on those in the community who already sort of have a leg up. To give sort of more of a tangible explanation for what I'm saying, I think the push for marriage equality is really great, and many people have benefited from that in phenomenal ways. But I also think at the same time that we have left out trans folks very sorely. And if, as my research suggests, that part of the issue with homophobia and anti-gay discrimination is rooted in gender, our priorities have not necessarily been oriented as well as I think they could be. Oh. At the same time, I have so much hope and inspiration from the rising generation. I think that now we're living in a time where identifying openly younger ages in terms of sexual orientation and maybe starting to be a little more so gender identity is more acceptable.
Much more, yeah.
And you can see sort of the fierceness that the upcoming generation brings in their self-assertion of identity. That even I'm technically on the cusp of being a millennial, although I don't really identify as one, but substantially different than from when I was growing up.
For sure.
I think the rallying cry that has happened around issues of social injustice, whether it be fueled by Black Lives Matter or some of these other queer uprisings, I think that the younger generation is sort of seeing to some extent these interconnections of different identity justice issues, and that they're not necessarily going to go away quietly with it.
And this is also a generation that is wedded to social media, just as my generation was. Well, we had basic television. That's about it. And encyclopedias. But, so as far as mobilizing and sharing information, it's at the fingertips all the time. So hopefully that will be used as a valuable tool for advocacy.
Right.
At a more personal and individual level, for people listening, friends, colleagues, fellow psychologists or therapists, what are other things that people can do? Or what are messages that you might have for, say, cisgender heterosexual individuals who want to understand, want to be of help, want to be embracing, and want to be on the side of people who are in the minority here? What do you want them to know?
Yeah, I think a couple things. I think that first, to seek out just additional information. One of the things that's really great about living in the internet age is there's a wealth of information on LGBTQ experience on the internet. Mm-hmm. It can be hard to, if you're a person who's gay, to continually have to explain what being gay means to people who aren't. And so if you want to support someone who identifies as queer, for example, look it up and do the job of educating yourself on people's experiences so that you're putting the onus on learning how to be a better ally as opposed to being someone who is seeking information from someone who already is going through a lot. That'd be the first thing. And I guess on a more sort of day-to-day interactive level, I like to tell my students to just to give pause when you encounter people who are different from you, and either maybe you're curious of like how they identify, what body parts they may or may not have, to give pause and to think, if you were in that situation and you had other people staring at you, how might that feel? That if you have a pausing moment to think about, well, why is it that I'm so invested in trying to figure out this person's, whether sometimes it's their racial identity or their gender identity or their sexual orientation, that you don't necessarily have the right really to interrogate them with your eyes in ways that may be offensive. So just sort of a little more reflexivity on the parts of people who come from a position of privilege in many regards. Sure. So it's about the education, and then it's also about just being a little more introspective of thinking through, well, why are you wanting to answer the questions that you have on your mind? And what would it mean if you don't find out those answers?
Yeah. What that brings to mind for me, too, is, you mentioned you meet someone who looks different ethnically. And, that's a question that I've had, are you Chinese? Are you Japanese? Or what are you? And on one hand, it's sort of, that someone asked that question in most cases from a benevolently curious place. But at the same time, it's kind of off-putting and kind of awkward.
Right.
And so while on one hand, it's like, well, I would expect that for someone who is cisgender, heterosexual, if they were to get to know people who are sexual minorities, that would help them break down some of their own stereotypes. At the same time, we wouldn't want people to think of someone who's a sexual minority or is genderqueer as like a case study or just something to learn from, right? So it is delicate.
Right. Yeah, and so I think it's, if you're interested in sort of forging, these forms of communication across difference, which I think is really what we're talking about, seeking out difference and similarity, that if you sort of come armed with knowledge that you've learned about, and say if it's like a really close friend who just came out and you're like, hey, I was reading about, this idea of queer, and I just wanted to see, like, this is how I'm thinking about it. Is that like, you're offering up something as opposed to demanding that something be produced for you.
Mm-hmm. Right. Anything else I haven't asked about, Steph, at this point that you'd like to kind of highlight or share based on kind of what we're talking about here today?
I mean, I think we hit on a number of the central features of the work that I've been doing recently, and just thinking about, one, that even though gender feels so natural to so many people, it's incredibly complex and complicated to think about and measure psychologically. And two, that when we think of sexual orientation, that it is not synonymous with gender identity or with gender expression, even though there is a relationship that can exist between them.
Right. Two very, very different things, three very, very different things, but inextricably woven together, and yet have to be understood both separately and in relationship to one another.
Exactly. Yeah. Exactly. And seeing the interrelationship between thinking about systems of privilege and oppression, that if part of the goal is to eradicate maltreatment of sexual minorities, then we need to also simultaneously work to eradicate our strict gender norms that have racial implications to them, right? So it's sort of like I'm asking for a tall order.
Indeed.
I'm saying that part of the work is holding on to the complexity and trying to move forward, addressing all of those things together and not necessarily just one piece of them, because making the argument you can't, and we've tried, right? We've sort of tried this one-ism approach, and it's not working.
It's inadequate, yeah. Well, and so you're talking about a broader theme of understanding a person in his or her intricacies and multiple identities and facets. Couple quick personal questions for you, Steph. Typically I ask them of guests here on Psych Rally who are fellow therapists or more in the clinical world, but I'll ask them for you as a researcher. Any book or resource that in a professional sense has really, that you recommend or that has been particularly important to you in your academic work and perhaps in your teaching?
Yeah. The book I would recommend to folks to read is called Queer Theory, Gender Theory by Ricky Wilkins. And I recommend that because it is incredibly accessible to think about some of the complex ideas that we've sort of been teasing out. Ricky Wilkins is a trans activist who writes about queer theory which can be very sort of obtuse and difficult to understand, even for academics. I will be honest, that queer theory has given me many a headaches. But Wilkins writes in such a way that my students seem to love. And for me, when I was becoming a budding researcher, finally had I get it now. So if any of the terminologies that I've mentioned, or the ideas of binaries, and where people fall in them, and also the history of the movements within the U.S., I would recommend that book. Gotcha. And it's not very long, but it introduces some really fundamental ideas that folks are trying to put into action with activism now.
Cool. Yeah, and it's always a gift when someone takes abstract ideas and theories and concepts and makes them practical and accessible.
Totally. And she writes about it. Yeah, she's like, my goal was that I had been writing this book, for many, many years in my head. And then one day I finally sat down and decided to do it.
Gotta do it. A piece of art, film, music, sculpture, architecture that just has really spoken to you in your life.
So I'm also a documentary filmmaker.
Yeah.
And I actually think one of the series that really struck me when I was learning about diverse gender identity experiences was a documentary that was done in the early 2000s called Transgeneration. It was a series that was done that followed 4 different trans men and trans women on their experiences in college.
Yeah.
And what I thought it did really beautifully was to show the humanity of trans people and how sometimes their experiences can be eroticized or pathologized, and to just sort of highlight that they're dealing with transitioning, but they're also dealing with adjusting to transitioning in college and what that experience looks like. There's been many great films that have been made since then, and that was sort of one of the first forays that went a little bit mainstream. But in terms of my development as an academic, I think that was one of the influential series that I had watched.
Gotcha. Yeah, I'm guessing I'd have to think it was even further, way ahead of its time in the early 2000s to have a film that caught the mainstream a little bit more that way.
Yeah, and they didn't do an explicit commentary on some of the intersectional pieces, but they did have some diverse socioeconomic classes represented in the film, as well as racial identities. So at least within my classrooms, it was able to provoke some provocative conversations among students to think more critically about, well, why was Racy's experience, distinct from the other ones about how she was trying to get hormone replacement therapy, right? Wow. She had to get off the street versus things like that.
Wow. Okay. And Steph, for you personally, is there an experience, a life event, a struggle, something that we all can learn from that you've been through, you'd be willing to share?
Yeah. This might seem, I don't know if it would seem a little bit trite, but I think it was really meaningful for me in the sense of the long-lasting implications that it had. So before I went to graduate school, I used to live in Ecuador, and I went there after college. I came out my senior year of college and decided that I wanted to simultaneously be out and proud and move into a society where that was not really a possibility.
I see. Wow. Against the grain, even more.
Against the grain. And, looking back, I'm sort of like, what? But I think this is it's a little bit unrelated, but also related to my work, in that part of what was so great about that experience was the cultural difference that I encountered from having grown up. I'm from the Midwest, from a rural, predominantly white area. And I think, Americans have this sort of obsession with success and individualism and constantly achieving to be something greater than everybody else. And it was during this time that I made friends who were Ecuadorian, and none of them cared that I got into grad school. They were incredibly uninterested in that was going to be the next phase of my life. And 10 years later, I'm still in contact with all of them, and they don't really ask me about what I did, where I'm going, what I am.
Just not on the map. It can be something freeing and refreshing that's not part of the conversation, huh?
Yeah. And so I think what I take away from that experience is that we get so caught up in having ourselves recognized for who we understand ourselves to be. And that while that is incredibly important and meaningful identity work, that there's also sort of a freedom that comes from relinquishing the importance of those various identities that we always care.
Indeed.
And so I think that it was in that year and a half that I was down there that I kind of realized that in a different way that I couldn't articulate until probably just a couple of years ago fully. That I was like, oh, right. I think I was missing something that my folks and my family down there knew well better, much better than I did.
They just got it better. Yeah. And that doesn't negate the importance and the value of, again, working hard at something and the time and the energy and the effort and the resources that you're putting into what you're doing with your degree. But at the same time, it's like, well, how can I do that and have it be meaningful while also kind of holding it a little bit more lightly?
I think that's right.
Yeah.
And I think that for those of us who are really impassioned as researchers or are as clinicians for doing sort of social justice work in our practice or in our research, that there is an element of self-care that we really need to take with doing that kind of work. And I think that experience, having lived abroad in that way and immersing myself in something that was foreign to me, really caused me to see that a little bit better. Right. That if we don't take care of ourselves in ways that are rejuvenating, then we're not going to be very successful or helpful to anybody.
So great to hear you in academia talking about self-care. I mean, something we talk about that was pretty much day one for clinicians in training. Hopefully we took that to heart. But, by all means, the amount of work that you do is taxing, trying, challenging in so many other ways. So I'm glad you're doing that too.
Yeah.
Steph, how can people access your work, your films, even the dissertation that we talked about? Is that accessible somewhere?
Well, they could reach out to me via email. And I'm also putting together a website that foregrounds my research and my video work.
Cool.
So should I say my email?
Sure. Yep. I can put it out there if you're okay with that.
Yeah, sure. That's fine. So it's Steph, STEPH .m.anderson@gmail.com. And the website is smanderson.org.
Gotcha. So you're going to have links to projects you're working on film-wise and research-wise, yeah?
Yeah.
Cool.
Yeah, and you can also find my research papers on academia.edu.
Cool. And presumably, is there intention to have your dissertation be published?
Well, I'm working on some individual research articles from it. So I'm incredibly flattered that you described it as all ready to go in book form, but I think it will probably be broken up into a number of different pieces for research audiences.
Well, however it gets out there, I'll be glad to see it and be excited to see what you've done here reach a broader audience. So thanks for your work, and so appreciate your taking the time to chat with me today, Steph.
Yeah, it's been great talking to you,
Okay,
Martin.
thanks, Steph. And that was Dr. Steph Anderson. And whoa. A lot of food for thought here. And so a couple reflections just in wrap up after speaking with her. It's so easy to forget that not long ago at all, just a couple decades ago, homosexuality was considered a mental disorder. It was pathologized as a label in our own Diagnostic and Statistical Manual for Mental Health Professionals, the DSM. It's since been removed, but that was not long ago. And even just a couple years ago, in our most recent version of the DSM, gender identity disorder was still a label. And now in our current version, the DSM-5, it's been changed to gender dysphoria, which, again, I think is a step in a good direction. But I think it's still, in my opinion, not the final ending point, because there's still... can there be distress that someone experiences as a result of wrestling with gender? Sure, of course. But the implication that just inherently that needs its own label, I think it can be problematic and invalidating for a lot of people. So not the final resting point, hopefully, for us professionals, but and at the same time, we've come a long way. If you're listening and something talked about here describes your experience, perhaps as a sexual minority or a transgendered individual, love to hear your reactions. You can, leave me a comment on the show notes for this episode at psychrallypodcast.com, episode 22, or on Facebook for Psych Rally. But my hope would be that hopefully there's some comfort and some validation in the knowledge and awareness that, discrimination against you and people similar to you is being talked about and studied, and that work like Steph's And hopefully similar conversations like these hopefully, are reflective of change and part of opening the doors for change in society that makes life easier for you and is more accepting of the different ways that people express gender. And to the extent that you resonate with some of the things that we talked about here, it's possible that many of these terms and challenges are old hat, that they're just a given, embedded part of your own personal experience of life. But for others, perhaps some of these terms and issues are totally new and eye-opening, and I'm glad you listened in, and I hope this was informative and leads you, just as it is myself, to really question and challenge and loosen our categories, lest we risk putting our friends and family in a box that just really misses the point and can even be harmful. So a couple of take-home challenges. First of all, don't take for granted the ways in which each of us may be privileged. An individual is made up of so many various aspects of identity, some of which create advantages and some of which may make us disadvantaged. And I, for one, am reminded after speaking with Steph to really reflect on being male, being heterosexual, being cisgendered, from a certain part of the country, certain part of this city, from a certain socioeconomic background, as well as certainly always where I descend from and ethnically and culturally. And those all mean something different in various contexts and may make life easier or harder. Also, please join me in heeding Steph's challenge of giving pause. So whether you're straight, gay, bisexual, cis, trans, queer, each of us in our own ways can benefit, I think, from reflecting on how we think about gender and our own experiences, moments, and aspects of our lives that perhaps maybe go against normative expectations. And what is that like? How do you do gender for yourself? In what ways are you consistent with gender norms, and in what ways may you be a little bit different or very different? And how have you experienced or thought about gender through the lens of race? Steph put it all together in her study, and you heard us talking about it here. Fascinating to me. One of the things that I'm also challenged and convicted to do is to really examine and own the impulse in myself to categorize a person based on gender. Because I think without realizing it, and even with good intention, it's taught from day one. It's so ingrained that we do it automatically. And, when someone doesn't quite fit in, it raises questions. You wonder. And, to the extent that it's benevolent, perhaps that's okay. But at the same time, what does give us the right? So I invite you to do the same, and something that I will continually hope to grow in for myself. And that goes for all of us, regardless of the color of our skin, where we come from, who we're attracted to, and how we express our gender. And finally, just one other hope for myself and fellow therapists, that we continue to be educated and informed and just be proactive in empowering ourselves to be of support to the sexual minority community, and the multiple ways in which an individual who expresses their gender differently may be disadvantaged or at risk for discrimination, overt, covert, and of course how uniquely challenging it can be to navigate their experiences, even more so when there are multiple aspects of disadvantaged identity. Because there are people out there around us, friends, family, who are wrestling with this every day and have to navigate it, have to manage other people's perceptions and expectations of them because they're not accepted or vulnerable. And I think that's something that us who are cisgendered, and certainly us who are therapists, really need to be proactive and intentional about. So please join me in that, because this is a time when remembering to respect the dignity of our neighbor, our fellow man, woman, person, is a core value that we're going to need to be bold in fighting for and protecting. So thanks again for Dr. Steph Anderson. Some great work that she's doing, and you can learn more about her work and see the resources she mentioned on the show notes for episode 22 here. I so appreciate you tuning in and listening to Psych Rally today. much more to come. So join me next time on episode 23 of Psych Rally.